Hello, good afternoon. Hello, good afternoon. Can you hear me? Yeah, I hope all of you are anxiously awaiting for the lecture on COVID-19. In fact, ever since the COVID pandemic has started, I've been gathering a lot of scientific as well as non-scientific information regarding this particular pandemic. And I thought it very much necessary to give you the salient points about the COVID-19. It is desirable because tomorrow when you are facing the examinations, you may be asked a few questions on the COVID-19 because you are the youth who have experienced the wrath and also the havoc created by COVID-19. And ever since the information is pouring into the scientific field, the various aspects of this particular disease, they need to update yourself on a day-to-day basis. Now, three things I would like to give you very clearly, though people are not following this, but you have to do this. Don't make this mistake. Don't ever talk or say that coronavirus, because coronavirus is a general term. There are several types of coronaviruses available. For your information, there is a group of coronaviruses, about 4 or 5 coronaviruses, which are responsible for our common cold. Most of us must have experienced several times in our lifetime the common cold. So coronavirus is not new to us. We have been experiencing the disease due to coronavirus. But by talking about saying about coronavirus, we are not referring specifically to COVID-19. Okay, so now onwards, after this class is over, please stop saying coronavirus, say COVID-19, because this is a term that is given by WHO to denote a specific type of a disease which is due to a coronavirus which has started in 2019, and this particular disease has caused a lot of havoc throughout the world. And I'm going to talk a little about this particular disease, which is going to stay with us for a few more years to go. Okay, so that's why you are obliged to know some information regarding this particular disease, both for a common man's purpose, but also as a medical student, because you are likely to face this particular questions in the examinations. Point number 2 that I would like to tell you is that when we talk about epidemiology, we are talking about the various aspects of the disease related to its distribution and also the determinants of the disease. I hope you remember the definition of epidemiology. Epidemiology is defined as a study of a disease and the determinants and also the distribution of this disease is very much important. And the epidemiology is very, very important because unless you understand the disease, you will not be able to go little further. Understanding the disease is only through the study of epidemiology. Okay. The third point I would like to tell you is that when I say prevention, I mean primary prevention, because the whole thing that we do in the medical field is prevention only. The primary prevention is something which is most desirable, failing which you may have to go for the secondary prevention. Failing in the secondary prevention, you may have to go for the tertiary prevention, right? Okay, so when I say prevention, I mean the primary prevention of this particular disease. So in future, whenever I talk about prevention, I mean mostly the primary prevention. Before going further, let me give you a brief introduction of this particular disease, because the disease has started almost 6 months before, and we have been knowing about the various aspects of this disease, and epidemiological, clinical, and all other aspects of the disease since 6 months time, and lot of concepts have come inside and lot of concepts have gone outside. So there's a sort of a dynamic nature as far as the disease description is concerned. So from time to time, we have to update ourselves regarding the disease. So before proceeding further, I just want to give you a brief introduction into the various terms that we are very much useful and very much required to understand any disease, and specifically a disease like COVID-19. Okay. Yes. The meaning was slide.
Yes, sir.
ఇది
అదేనా మీడియా సార్?
కాదే
రావట్లేదు సార్ ఆ స్లైడ్.
పోనీ ఇది ఒకటి చూపించి సరిపోతుందా? ఇలా సరిపోతుందా? మళ్ళీ దీనికి వెళ్తే పోతుందా?
దీనికి ఎక్స్ప్లెయిన్ చేయండి సార్.
దీన్న ఇలాగా
మూడో స్లైడ్ ఇది రావట్లేదు.
వచ్చింది. I'm sorry for the technical error that has caused some sort of inconvenience to all of you. But I thought that these are the terms which you should remember throughout your life, and you should understand them extremely well, because we are going to face a lot of these problems in future also. The first and foremost term that we have to remember and understand clearly, pandemic. The term is self-explanatory. Pan means all, demic means the people, all the people are involved. So it's called as pandemic. Pandemics are not new to us. We have been facing pandemics since a very long time. And as far the record goes, we had several pandemics in the past from three diseases. One is a pandemic of plague. This second one is the pandemic of smallpox. The third one is the pandemic of influenzas. And these are the three important pandemics we faced in the past. And we are very happy. We are very happy that we will not be having a pandemic of smallpox, and the pandemic of plague is extremely rare now, and pandemic of cholera, which was causing death of millions of people in the past, is again a rarity now. But the pandemic of influenza is very much possible anytime in future also. We have to remember 1918, almost 100 years back, we had a pandemic which is called as Spanish influenza and Spanish flu, because it had originated in Spain, and from Spain it has gone to several countries in the Europe and also India. And during that time, uh, at least about uh, 40 million, 40 million, that means 4 crore people have died as per the records. It may be little more than that, because those days the healthcare facilities are extremely low and the documentation is extremely low. Probably more number of people are affected and more number of must have died during that time. As per the uh, lecture given by the WHO Director Journal, he says that it may be about 100 million people who died during that time. So, when compared to that pandemic, this pandemic is extremely negligible. But at the same time, we cannot give less importance to this pandemic. In general, pandemic has got 4 phases. The first and most important phase is the interpandemic period. That means any disease will go into a pandemic, and there is a period in which it is quiescent, it is quiet, nothing happens during that time. And suddenly, when once the pandemic starts, there is a change in the antigenic structure of the organism causing the disease. So all the people in the world become susceptible for this disease. That is phase number 2, when there is a antigenic change, which the disease spreads in specific local area. One small area it spreads, and slowly it spreads to the whole country, and from after spreading to the whole country, it may go to the other countries also. That is, it is a phase of spreading. It goes on spreading. But most of the time, it remains person to person transmissions. And the transmissions, they are limited to direct transmissions most often. And usually the transmission occurs from the animals to the human beings, and from the human being, it goes to the other human beings also. This is the phase 2. And the third phase is called as community transmission. The community transmission is a very, very violent and vibrant type of pandemic, where thousands and thousands of people, they get affected, and sometimes whole village may be affected, whole city may be affected. There may be large number of deaths occurring in this. That is what is really happening in a country like United States, especially in New York and other states, where thousands of people are dying every day. It is an example of community transmission, and it's so difficult to stop at this point, because it spreads like a wildfire. You know, it is so difficult to stop a wildfire. Similarly, this wildfire is never ending, and it goes on, goes on, goes on for some time, till all the susceptible people are affected and all the susceptible people die due to this particular disease. So when that the violent outbreak of the disease is going on, and a stage will come when the disease will not spread further. So there is what is known as plateauing. Plateauing means the flattening of the curve, and the number of people affected may remain stable for some time. And slowly, steadily, when the people become more intelligent, they become more cautious, they become more careful. What happens is the pandemic slowly comes down and reaches a zero level. And in between, there may be some spikes. During the flattening also, there may be spike occurrence of sudden increase in the number of cases, right? Okay, so pandemic is a disease where it starts in one place and rapidly, widely distributed throughout the world, and from the world it goes on. And sometimes what happens is the pandemic goes to one country to another country, takes complete circle of the whole world. Again, it it's reintroduced into the place where it has occurred first. Okay, so that means we call it as resurgence of the pandemic. So this goes on till people are careful, people take precautions, and all the susceptible people are affected, and all the susceptible people have died. The pandemic goes on and it plateaus, and then it declines. These are the four phases of the pandemic. I hope you will be able to write one short note than the pandemic. So to give you the correct information about pandemic is not a new thing for us. We have experienced several pandemics in the past. Probably this is the pandemic which you are experiencing because we are present at this point of time. Now, coming to the next term, that is epidemic. Epidemic is a simple um, a disease which occurs in a local area, and the number of cases expected are not expected to occur in that area. Epidemic means a sudden occurrence of unexpected cases of a particular disease. Okay, so here when I talk about epidemics, we have got several epidemics. Epidemics of the food poisoning, epidemic of gastroenteritis, epidemic of measles, epidemic of malaria, epidemic of dengue fever. All these things, they are common throughout the world and they occur almost every year, and it is usually confined to a small area, and from there the disease may spread to a few places around, and again it stops and it may not cross the country borders. So pandemic is an epidemic which is on a global scale. Okay, again here pandemics, whenever we talk about infectious diseases only. We don't say pandemic of cancer. A disease is there, cancer is there throughout the world. We don't say pandemic of cancer. We don't say pandemic of diabetes mellitus. We don't say pandemic of hypertension. So here the most important element in pandemic as well as epidemic is it is the question of infectiousness of the organism. And in the epidemic definition also, the most important term is number of cases occurring which are not expected. Okay. Say for instance, in India, yellow fever has not been documented even once. Not even one case of yellow fever has been documented in this country. Whereas yellow fever is a very common problem in the Western African regions, especially Nigeria. A large number of people die every year, even now, due to yellow fever. Whereas in our country, though we have got all the uh, environmental factors and host factors available in this country, we do not know till today. It's an epidemiological, question why this disease is not seen in this country. So even if one case of yellow fever is detected in this country tomorrow, we can call it as an epidemic of yellow fever. That means epidemic doesn't mean all the time that a large number of people should be affected. It is the large number of unexpected cases that are occurring in an area is called an epidemic. So, okay. I think you have understood both pandemic as well as the epidemic, and you will be able to answer questions on these two aspects. Then the third point which I would like to tell you is the quarantine. Quarantine, very often nowadays on the TV you're getting a lot of information about quarantine, and a lot of people do not know what is meant by quarantine till today. Okay, so I just want you to note down or at least keep in your mind the correct definition of quarantine. Quarantine is the segregation. Don't say isolation. Isolation is totally different term. Segregation of all the suspected and exposed persons for the maximum incubation period, that is called as quarantine. That means when you are quarantining, all these people are apparently normal, healthy individuals. Okay, so if you are working in a quarantine center, you are dealing with apparently normal individuals. The risk is there of infection, but risk is extremely low because all these people are not having the disease symptoms. The moment they get the disease symptoms, they are removed from quarantine and they are sent to isolation. Okay, you have to understand this. Quarantine centers are not the breeding places for the disease. It is a place where you observe a group of people who are suspected to have exposed to a disease producing organism or infectious agent, and they are possibly incubating the organism inside their body. Any point of time they may show symptoms or they may not show symptoms also, because the mere fact that they're exposed doesn't mean that they get into the disease. Okay, so quarantine is a very specific term. Don't misuse it, don't misquote it. Quarantine is the is a segregation of the people for a maximum period of incubation period. Okay, and for this you should have a correct information or at least an approximate information about the incubation period. Otherwise, the quarantine may not end at all. As far as COVID is concerned, we'll come to know that the quarantine, the maximum incubation period is 14 days. The minimum incubation period may be 2 or 3 days also. In the Wuhan epidemic, they have calculated the incubation period as 5.7 days. Okay, so we don't segregate only for 5 days or 6 days, but we always segregate a person for 14, because there are not many people developing symptoms after 14 days. That is the maximum incubation period. Remember, incubation period, there is a minimum incubation period, a maximum incubation period, and the average incubation. But for quarantine purpose, we always take the maximum incubation period. Okay, this is a wonderful, epidemiological procedure by which we are able to stop the spread of the disease, and we are going to give safety to the people who are living in that community. Then we have one more important definition which you should remember, that is isolation. Isolation is the segregation of all the people with symptoms. All the people, please underline, all the people with symptoms. That means they're already in the process of disease. The incubation period is over and the people are having the symptoms suggestive of the disease. And they are potentially capable of transmitting the disease. So you have to segregate all these people because they are already giving the organism from the body, and the organism may be transmitted to all the normal or healthy individuals. They are highly dangerous and they should always be removed from the community and they should be kept aside. There is nothing like home isolation. It is not possible. Home isolation is extremely difficult. Nowadays, you are talking about home quarantine. Yes, it is possible, home quarantine, because the people are normal. They do not have any symptoms and the risk is very low. Home quarantine can be accepted, but do not talk about home isolation. Some people are talking about home isolation, which is not a correct type of a procedure. And now, how long you would like to isolate a person? The person should be isolated at least for the maximum period of communicability. Okay, if you don't isolate them for the maximum period of communicability, again the risk is extremely high. And how do you know the maximum period of communicability? At the beginning of the disease, you take a you diagnose the disease by doing the antigen testing, and after symptoms are over and the communicability is over, you again test the person and it should be negative for the organism. Then only you can remove the person from that particular segregation. The maximum period of communicability has been shown to be around 7 to 14 days. And some people may not be communicable even after 3 days. With the high levels of immunological system, the people may stop the transmission of the disease within 3 or 4 days also. That's why for isolation to be stopped, for isolation to end, the most important thing that you should do is you have to do the lab testing and see that the organism is not there. They should be tested negative for that. Then only isolation ends. Hope you understand between the terms, the difference between quarantine and isolation. Quarantine, we can definitely give some from lenience, whereas isolation, it should be as strict as possible. And most of the places, isolations are done in a single room, and the contact, human contact, is extremely negligible. Okay, even if you want to give food to that person who is in the isolation period, you may have to take extreme levels of precautions, and you should be careful in reaching to those people. Anyhow, when we are treating those patients in isolation ward, we may have to go and talk to them, but at the same time, unless you take precautions, tomorrow you may be in the isolation ward. Okay, so take enough precautions when you are doing the isolations, but quarantine is relatively less risky and low risky environment. Now we have one more important term which most of the people are nowadays talking about. It's called as secondary attack rate. Secondary attack rate. Now, Tabliki and also the Coimbedu, these are the two areas, places where people are exposed to this disease, and these people have gone to several areas, and there they got in, they infected other people. Now, the secondary attack rate is, there is one primary case, and some people are exposed to that primary case, and all of them are supposed to be having the organism inside their body. But at the same time, remember that in biological systems, 2 plus 2 is not 4. It may be more or less. So, all the people are exposed to the disease may not develop the disease. Okay, so the suppose you remember, you think that a primary case, some 10 people are exposed, and you are trying to keep them for the maximum incubation period, and during that 10 days time, during that incubation period, out of 10 people, you find that 3 people are positive for the disease. That means from the primary case, the contacts getting the number of getting the disease is taken into consideration. Secondary attack rate is nothing but number of the people tested positive divided by the number of people who are exposed into 100. That gives the secondary attack rate. In China, when they have conducted the epidemiological studies, they found that the secondary attack rate in COVID-19 is up to tune of 2.3. That means, though there are a large number of people are affected, especially in the family setup, there may be 10 family members or 15 family members, all are exposed to the disease because the primary case is inside the house, and out of them only 2 or 3 people are affected. That is, secondary attack rate is not that significant. There are several diseases where the secondary attack rate is up to the tune of 9 or 10% also. Okay, so it is that way. This organism is not extremely dangerous virus. Then we are nowadays talking about community transmission. Community transmission is that the disease is spread from one person to person in a community so easily that there is no need for any primary case. In the limited sense, you should have a primary case, and then from a primary case, a lot of people get infected. Whereas in the community transmission phase, there is no need for any primary case, and it just goes on spreading from one person to person in a very rapid succession, and sometimes the whole community may be infected with the same virus. So community transmission is something very difficult to very difficult to stop, and we should always remember we should not go to this to that level of community transmission. Only God saves us when once community transmission sets in. Then we have uh, a term which is nowadays used that is called as contact tracing. That means when once a person is positive for a disease, you should always suspect and anticipate that there are large number of people who are affected or exposed to that fellow, and you should go on catching the string and pull that string in such a way that all the people who are exposed are brought under the quarantine procedures. Otherwise, even if you are leaving a small proportion of the people who are exposed, they become the transmitting agents, and they are responsible for the community transmission in future. Contact tracing is a term which was used more uh, relevantly in the case of sexually transmitted diseases, and they stop these sexually transmitted diseases. They could prevent it only by virtue of contact tracing. Contact tracing is now a very laborious process, and we have to depend on the person's verdicts. That means a person who is infected, he says that I was talking to that person, I was talking to this person, I was talking to that person. So he should be able to give the complete list of people whom he has contacted. If he is not able to recall everything, the contact tracing becomes most useless procedure. Okay, so contact tracing is a very important epidemiological procedure, and at the time of pandemic, it gives a lot of useful information, and it gives us a hope for prevention. Then we have another term known as serial interval, which is very often used in epidemiological studies. Serial interval is that the time taken from the first or primary case to the secondary case. That is called as a serial interval. That gives us an approximate idea about the incubation period. So serial interval is one way of finding out the incubation period. If you do not know the incubation period, you do not know how to do the quarantine. If you do not know the incubation period, you will not know how long a person has to be retained in a quarantine area. So that's why knowing an approximate interval, so the incubation period, is essential for all the epidemiological activities. The exact incubation period may be obtained a little later, but serial interval, you can easily get it, and it can be implemented on an immediate basis. So these are some of the specific terms that you should remember. One is the pandemic, the second one is the epidemic, the quarantine, and the isolation, secondary attack rate, community transmission, contact tracing, and serial. All these things can come to you as short notes in the university examination. Then I will be dealing with some of the measurements of pandemic. Pandemics are measured unless you have a measurement of the pandemic. You do not know the extent of this pandemic and severity of this pandemic, and the spreading of this pandemic cannot be easily obtained, because these terms you should have, otherwise you are likely to make mistakes. One is case fatality rate, and nowadays some people are using it crude fatality rate. Both are same. The case fatality rate is nothing but the total number of people dying due to one specific disease. The case fatality rate is an excellent expression of the severity of the disease. If the disease is severe and the host responses are extremely low or nil, there is a possibility of 100% case fatality rate. I hope you remember that during my course of lectures, I told you several times that there is one disease which has got 100% case fatality. That is, do you remember? Yes? Anybody? There is one disease which has got 100% case fatality. Okay, you remember that? That is rabies. Rabies is a disease which is having 100% case fatality. Whereas all other diseases do not have 100% case fatality. AIDS is one disease. You used to think that it's 100% more the case fatality rate, but over the period of time when we have invented some drugs for the disease, we were very much sure that it is not 100%. So, case fatality rate is an expression in which we calculate the total number of deaths due to one disease divided by total number of in diseases reported into 100 or 1000, whatever it is. If the case fatality is extremely low, you may have to use the multiplying factor as 1000. You can't say 0.1% case fatality rate. That's why in those cases we may have to multiply with the figure of 1000 or even more. So, in due course of time during my lecture, which I have divided into two parts, today I am going to deal only with epidemiology, and next class, that is next Wednesday, I'll be dealing with the prevention. To give a little time and also the time to understand this disease, I am trying to give you in a very leisurely way, that is, and I'm going to show the case fatality rates of this particular disease a little later. Second one is a proportional case rate. Out of the total number of diseases of all types concerned, what is the proportion of this particular disease under observation? So that shows an administrative clue to deal with this particular disease. Okay, if you have tuberculosis, malaria, dengue, and filariasis, and viral hepatitis, cholera, all these diseases are prevalent in a given community. But you would like to prioritize the treatment and also the prevention procedures for this disease. For that, you require a proportional case rate. And the proportional case rate is a very important parameter by which you can plan all your preventive activities and also prioritize your preventive activities. Then we have the disease specific morbidity rate. And this is nothing but the proportion of this particular disease out of the diseases available there. Age specific morbidity rate. Which age is affected more commonly, which age is less affected more, you can come to know from this age specific morbidity rates. And you know, some diseases are more common during childhood, some diseases are more common in the adult, some diseases are more common in the very old persons. So age specific morbidity rates are important to know and give the concern for this particular age group. Gender specific morbidity rate, again, which group, is it more among the males or more among the females? For example, in the case of malaria, it is more the 3 times more among the males. And so you have to remember gender specific morbidity rate is also important. Similarly, disease specific mortality rate, age specific mortality rate, and gender specific mortality. So these are some of the measurements that I'm going to use for the explanation of the disease in epidemiological sense. Okay, so all these things are important because you have to understand first of all the disease. The disease, if you understand well, you will be able to deal with the disease, treat the disease, and prevent the disease in a befitting manner. If you don't understand it, we are almost like blind people and we are trying to treat the people without any knowledge. Now, let me start the discussion on COVID now. The COVID historical aspects are important because from the history only you will come to know what is right, what is wrong. What are the mistakes that you have done? what are the good things that we have done in the past, and from there how to rectify ourselves. Okay, historic aspects are important, and you know very well that disease has started in China, and the first case was reported in Wuhan Jinyintan Hospital on 30th December 2019. That means almost near the end of 2019, the disease was registered, or the registered was confirmed. It is confirmed. It doesn't mean that cases were not there before 30th December. Even in the month of November, China experienced in the Wuhan province uh, a large number of people suffering from unexplained the pneumonias, unexplained cough and cold, and high degree of fever. They were in very large numbers getting treated by the general practitioners. They were thinking that it is a case of influenza, a case of respiratory infections, and they were giving symptomatic treatment, but they found large number of these people are affected, and large number of people are were suffering, and many people have died also during that period. And it is of great significance at this point of time that when they went into the details of all these cases which are occurring in the month of November, most of the people, they have given the history that they have visited the wet market in Wuhan. Wet market is a place where the animals are sold. Animals, the sacrificed animals are sold. A non-vegetarian material is sold there. So large number of people have gone to these wet markets, and people who are actually handling the carcass, handling the non-vegetarian materials were also affected. That clearly shows that the disease has started in the wet market in Wuhan, and it gradually spread to the whole of Wuhan, and it rapidly grew from 10th to 22nd January 2020. That means, though first case was reported on 30th December, even before December, in the month of November, we had unexplained cases of respiratory illness in Wuhan, and the number of cases were almost manageable. But from 10th of January to 22nd January, the number of cases extremely high. That is the period when the country of China has sought the help of WHO. The WHO, till that time they thought that they can manage the situation, but 10th onwards they were totally out of gear. They were not able to deal with the disease from 10th to 22nd January. It is a sort of memorable time for even the administrators in China, that is the time when a large number of people are reported. The health systems are overcrowded. Health systems are almost thrown into helpless situations during that time. So WHO has gone there and studied the situation in China during that time. And after that, cases plateaued between 23rd January to 27th January. In fact, that was a time when the people have actually started their preventive activities, and they have plateaued, and probably this phase 3 has come. Phase 3 has come. I was talking about the epidemic or pandemic. Phase 3, that is plateauing, and the number of cases have not decreased. They have plateaued. The number of cases reported remained static for some time, for about 4 to 5 days. And they have seen a spike in the reported cases on 1st February. So far, they were not able to give the explanation why they have experienced a sudden surge, sudden increase in the number of cases on 1st February. It's very clear that it is almost 3 times the normal daily reporting. That clearly shows that something really happened on that day when a large number of cases. Maybe the surveillance teams are very active on that day and they are reaching large number of people, are doing testing on large number of people. Probably when the large number of people are being tested, you get more number of reported cases. 50 per day in late January, and slowly it has come down to 50 per day since mid-February. After that, the disease has completely vanished for some time. On 16th January, the WHO again visited the place, and a joint committee with the China experts and WHO experts, they sat together and they have declared it as a potentially pandemic situation there, and they have alerted all the people throughout the world to be careful about this particular disease. Though there are several people who are trying to, blame the government and also Chinese government and also WHO. I still remember on those days, on those periods, the both WHO as well as China has warned the entire world, including the developed world, to be careful about it. Okay, so there's a wonderful report. I think you should be able to get it from your Googling, and WHO Joint Committee report is an extremely nice report and extremely detailed report that they have given, and that is worth reading. Those who can download this particular PDF from the net, please do that. A total lockdown was implemented from 18th February 2020 in Wuhan city, and that lockdown is no way comparable to lockdown anywhere else in this world. Because some of the people whom I know in China, I was talking to them because I worked in China, you remember. I worked in China for about 2.5 years, and I know some people in China. I talked to those people and they were telling the horrible stories about lockdown. And the lockdown was so severe that people were just not allowed to step out of their houses, and it was almost like a rigorous imprisonment for the people in Wuhan. And that was the lockdown which has definitely given them a lot of help and a lot of relief to those people. So you have to remember that unless you do something, you don't get something. If you have to get something, you have to lose something. This is the excellent example where we can see from the truth that is happening there. And one particular family, when they were resisting the lockdown, the officials have sealed it from outside and they have put nails to the door, and they did not allow the people to come out of it. And during that time, there was a death in the family, and the dead body was kept inside the family for about 24 hours because there were no people to vacate the dead body from the house. So the total lock was sometimes even inhuman also in Chinese context. Okay, so if you think of our own lockdown, you can remember a lot of people are coming out, a lot of people are not even wearing masks, a lot of people are not using the social distancing, and the lockdown only for about worked for about 2 to 3 weeks time. Later on, people have just not bothered. Okay, same thing happened in United States also. Though lockdown was promulgated in this country, a lot of people started going for weekends and enjoying the weekends. So now they are reaping all the bad things from this indiscriminate behavior. China is happy because they have gone through that cruel and very rigorous type of lockdown. That's why they are happy today. A cumulative total of 55,924 was given on 20th February. That was the number given on 20th February. And total reported by 23rd May 2020. That means the Chinese government has accepted that there is some sort of lapse in the uh, data collection, and so the data that is given, the total cases 55,000 is extremely low estimate, and they could find out that it is 82,971, that is 57.9 per million population. Always remember, you have to calculate the total case load taking into account the population of that country. If the population of the country is less, the parameters are also more. So on 23rd May, the case rate or the infection rate has remained at 57.9. That is, it includes all the cases which are reported. It doesn't mean that the cases are existing that time. It is only the data that is available on that particular day. Total deaths reported on 23rd May is 4,634, and it is extremely low when compared to other countries which are experiencing thousands of deaths now. And finally, the case fatality rate was 32 per 1,000 cases. It is 3.2% or 32 per 1,000 cases, which is seen in this country in China. So this is all about historical aspects that are occurred in China. Now let me give you quickly the historical aspects of this country. What had happened in this country before I wind up my class. First and foremost thing is, air travel was suspended on 18th March 2020. Our Honorable and Noble Prime Minister has been very proactive in the beginning of the pandemic itself, and he has banned all the flights coming from the foreign countries on 18th March itself. This has given us a wonderful respite, wonderful time for us to prepare ourselves for the primary preventive activities. So even as an epidemiologist, I really appreciate our Prime Minister for doing this on 18th March. On an experimental basis, he has introduced a term known as Janata Curfew, and it was imposed on 22nd March 2020. He just wanted to test people, how people will follow the procedures of curfew or keeping at indoors. And he was very happy and successful, and even I experienced, and we have all experienced, that Janata Curfew was a grand success. Nobody has come out of the house on that particular day. Okay, so this is a sort of an experience he wanted to give to the people, so that in future the curfew is going to continue. And lockdown 1 was promulgated on 25th March 2020. It was very rigorous, but no way comparable to China's lockdown. But we have done a wonderful job for 21 days. From 25th March, 21 days, we had a first lockdown. Lockdown 2 started on 15th April 2020, and again it lasted for about 2 weeks. And lockdown 3 started on 4th May, again it lasted for 2 weeks. And lockdown 4 has started on 18th May, again it started for about 2 weeks. That means the lockdown 1 was about 3 weeks, and later on each lockdown was limited to about 2 weeks or little more than 2 weeks for four lockdowns, that is. At the end of 18th May, at the end of 31st May, we have come to the total closure of the lockdown 4, and now we are in the phase of lockdown 5, and we are also trying to unlock the lockdown effects so that the economy of the country is again rejuvenated. Now, commercial activities and industrial activities have resumed. Tramit trains moved throughout the country so that all the migrant laborers who are actually detained during the um, lockdown period are sent back to their houses. And Vande Bharat service have initiated, where we brought all the people who are stuck in the international, in the areas, who have gone for some sort of conference and some sort of visits to their family members, and they got locked up there for about 2.5 months, and all these people are being brought back to this country. And regular flight and trains are resumed now. So this is how India has gone through, and is a wonderful procedure that is followed by our Prime Minister, and the results are in front of us. We are very happy that we are the country having the minimum amount of case fatality, the lowest levels of case fatality rates, and highest levels of recovery rates, and relatively low level of infection rates. And I'm going to talk about all these aspects in my next class on 10th of June, and be prepared for that. I hope all of you are able to note down certain things that which I'm talking now. And just like any regular class, I expect you to take down some amount of notes, because notes is something which gives you a sort of a recall at a later date. So to sum up my talk for today, I have just dealt with the historical aspects of the disease. I've also given you detailed information about the various types of terms that are necessary to understand the pandemic of COVID-19. Again, I want to uh, ascertain and repeat my request to all of you: don't call it as Corona, call it as COVID-19, and call it. Do you know the name of the organism? Disease is called COVID-19. What is the name of the organism? Do you know this? Anybody knows? Okay. For your benefit, I am giving you the name of the organism is SARS coronavirus 2, because the SARS is also due to coronavirus, and that is coronavirus number 1. And this disease, because it is almost same like SARS, this one, it's a coronavirus number 2. This is the name of the organism. Disease is COVID-19. The organism name is SARS coronavirus 2. So with this information, I take leave of you, and again I'll meet you on 10th of June. Hope you will also get little more information, because unless otherwise you are going to unless you are up to date with the disease epidemiology, you will not be a good clinician in future. Thank you very much.